everyone, I'm Dr. Z. I'm a clinical psychologist specializing in transgender care. Welcome to my channel. Today I want to talk to you about how to go about finding a mental health provider that has some kind of knowledge in transgender care in your geographic area. And I know this can be really challenging for a lot of people, but it is incredibly important that you try to find a provider that at least somewhat knowledgeable in transgender care. And let me tell you why. This becomes very important. There's a big difference between people who specialize in a field, and there's a very big difference between people who don't specialize in the field and don't know what the hell they're doing. Now, I know today a lot of providers say they're LGBTQ friendly, but that doesn't tell you much at all about their specialty. It doesn't tell you much at all how many patients they have seen that are transgender identified. Now, here's the biggest difference when you see somebody who is not a transgender specialist, because they don't specialize in it. They don't know how to properly assess for gender dysphoria. So that means they're going to spend that much more time with you, listening to your narrative, trying to satisfy, more than anything, they're trying to satisfy themselves because they're worried they're going to make a mistake, in trying to figure out if you truly do have gender dysphoria. And what happens is that because it takes longer period of time and you're suffering and you're going through symptoms, that means your transition and your transition goals are going to be delayed. And that's a big problem. We don't want to delay your gender transition if that's your goal. And if you're ready for it, there's no need for you to delay that. In other words, there's no need for you to be in therapy for 6 months to a year if you're already sure about your gender identity, if you're experiencing a lot of gender dysphoric symptoms, and if you are ready to start hormones. There's absolutely no need for you to be in therapy exploring your feelings while you're not getting the proper medicine. Let's say hormones is the proper medicine to treat the medical symptoms. Again, I make this analogy all of the time about, cancer and gender dysphoria. I know, horrible analogy, but it works, and this is why it works. You can't go see a generalist doctor, right, who's going to have to try to spend 6 months to a year trying to figure out if you really do have tumor without getting you on a chemotherapy treatment. Do you see how that 6 months to a year can really land you in terminal position? The same thing here. It's very serious. Gender dysphoria affects all of us in a very severe way, and it's a very serious deal. So you do not want to wait 6 months to a year. So that's one of the biggest things. Another thing when you're working with somebody who is specialized, the benefit of that is that specialized people know the timeline and trajectory. And based on your situation, based on your access to resources, right? Let's say you have access to excellent resources. Then if you're working with me, for example, I know in geographic area, if you do want to get surgeries, I do know which doctor is booked how far in advance. I also know which doctor to recommend you to. So you see that really affects timeline. And then if you also don't have access to resources, I know how to connect you to resources, how to get maybe a state-funded insurance, a Lake Care, for example, here in Los Angeles, California, that covers anything of trans-related service. So this is another really important key difference why you want to work with gender specialists. Now, I know that gender specialists are very scarce. I get it. I know there's a lot of people, or very few people, I would say, that barely specialize in gender issues. But there are people who do. And then there's a lot of people who don't really specialize it per se, the way I specialize. For example, that's all I do. All I do is work with transgender people. There are some people who specialize in different areas, right? But they also do see some of the trans folks. So they do have some experience. And the key is, in your geographic area, if you can't find a specialist like myself, how can you find somebody who is at least knowledgeable enough to work with you and not to delay transition? At least they're knowledgeable enough to reach out to people who are specialized like myself and to consult and help you how to get faster ahead of your transition. And the way you can find providers in your geographic area is twofold. Actually, I would say threefold. One way you can find it is you can go online and you can type in transgender therapist, see what comes up. And then you can just look up what their experience is. You can have a consult via phone or request a consult via phone and ask them, what is your experience? And most importantly, how many transgender patients have you served? Okay? If they're going to tell you that their experience is minimal and they haven't served anybody or served very few transgender patients, ask them if they would be willing to consult with somebody who's more specialized. If they say yes, that's great. By the way, feel free to pass on my information. I'd love to consult and help them out. If they say no, well, that's a problem. So that's one way you can try to start looking for provider in new areas. The second way you can start looking for provider in new areas, you can go to WPATH.org, and I'm going to put a link below. It's a world professional organization of transgender health. Now, of course, pretty much anybody can be a member of the WPATH.org, but chances are the membership dues are expensive. So people who invest in WPATH are going to be people who have interest working with gender diverse individuals, people such as myself. So when we get signed up and pay membership dues, we have an option to be listed in the provider list. I'm listed in the provider list along with a lot of my other colleagues who are members of WPATH. WPATH has, again, I'm going to link below, has a provider list where you can go and you can put down your geographic location. There's a drop-down menu, and you can look down who is in your location who is also a WPATH member. And that will at least ensure that these people are somewhat interested, if not pretty well versed in gender issues. Again, because we're paying this membership fees, and if I'm not working with gender diverse people, why am I paying so much in membership fees? So that's a second great way to look for provider. The third great way to look for mental health provider in your geographic area is look up who are specialists, even not in your area. So let's say me, there's other folks, there's people in York who are also specialized. Reach out to them. Don't be afraid to contact professionals in the field and ask them, hey, do you happen to know anybody who is remotely familiar in gender issues in my geographic area? Chances are we do, because we all collaborate and we all network and work together. If we don't, chances are we have ways of trying to reach out towards the geographic area and trying to find a provider for you. So that's the third way that can be really helpful in finding provider. But trust me, you really, really do want to work with a gender provider, somebody who's at least somewhat remotely familiar, because as I said earlier, it can really save you time. And time is precious. Time is investment. Time is something that not all of us have. And especially when you're starting out transition, this can be really, really essential. Now, I understand if you're just starting to question your gender and you're really not sure about transition and you just want to go to therapy to work through those issues, well, guess what? You still probably want to work with somebody who's knowledgeable enough to at least work through those issues and for somebody to be able to understand them. You know, the analogy about the specialist is that it's kind of, at least for me, I became so specialized to the point where if somebody walks into my office, within a few minutes of conversation, I know where the kind of land on the gender spectrum. And chances are I'm probably highly accurate most of the times. That's because my narrow window of view of symptomology and listening to narrative has got so narrow because I only work with trans folk. I'm quick to assess and to win out everything else. Well, if I serve everybody else and I see everybody else, then my window is really wide and open, and it takes my brain a while to figure out where you land on the gender spectrum. So do you see why it becomes really, really, really important? So there's to go to your 3 reasons to find gender provider in your geographic area. Hopefully this helps you. I know that it's very difficult, and in some geographic areas, you won't find somebody who is even remotely familiar with gender issues. In that case, you know, it really sucks. You know, your best bet is just to go to therapists, and hopefully they can reach out somebody to consult, which, by the way, mental health providers are ethically trained. That's our ethical responsibility. If I am in a geographic area where there's not that many mental health providers and I don't specialize in a particular field, but you walk into my office and you have particular symptomology I don't specialize in, and there's nobody else that can help you, it is my ethical responsibility to at least start consulting with somebody to gain understanding to serve you better. So don't be afraid to ask therapists to reach out and consult. Comment below, have you had experience when you worked with gender or somebody claiming to be a gender therapist who wasn't really helpful, who was kind of derailing and dragging and wasting your time? Really, that's what actually ends up happening. And have you ever switched to working with a specialist, and how that has made any difference? Share below what geographic area you are at. Share below what is challenges you struggle. I know that mental health providers are one of the biggest challenges. Another biggest challenge is finding medical providers, especially endocrinologists that can provide hormone therapy, or medical doctors who are trans knowledgeable to provide provide HRT in geographic areas. All of those are incredible barriers that all of you face. But please comment below. Let's have the conversation going. And I look forward to hearing all of your comments. And I love listening to all of your feedback and everything that you guys share. Thank you very much. And I'll see you all next time. Bye.